A very warm welcome to everyone joining us today. I'm Shazia Shabir, your host and moderator for this exciting session presented by Neuroptech, a growing platform dedicated to connecting young optometry professionals and students with knowledge of 6-6 in optometry. As optometrists, we often focus on achieving that perfect 6-6 visual acuity. But what lies beyond it? What makes us see deeper, think broader, and redefine excellence in eye care? To help us explore this thought provoking theme, we are truly honored to have with us Dr. Brajesh Kumar, Senior Faculty Optometrist and in charge of posterior segment diagnostics at Dr. Shroff Charity Eye Hospital, New Delhi. With over 16 years of rich clinical and academic experience, he has been a guiding force in advancing retinal diagnostics, ophthalmic imaging, and optometry education and training. His dedication and contributions to the field have inspired countless students and practitioners across India, and today we're fortunate to have him share his insights with us. But before we begin, I'd also like to acknowledge the vision behind this initiative, the people who made this platform possible, Mr. Adnan and Mr. Asad, the founders of Neuroptech. Their efforts have created a space where optometrists can learn, share, and grow together. Now, as we dive into today's discussion, let me tell you that this podcast will unfold in four interesting segments, each exploring a unique dimension of our topic. So, without further ado, let's move forward. Our very first segment, hosted by Adnan. Adnan, over to you.
Thank you, Shada Sabir, for your incredible moderation. And thank you, Brajesh sir, for making this day special. I would like to thank our co-founder for his incredible idea. Before starting, I would first like to define what the actually Neuroptech means. So, Neuroptech is not only a community, it blends with the two words neurooptometry and the AI-based optometry technology. So this is a collaborative community, a interdisciplinary collaboration between the students and the all the clinical practitioners, all advanced practitioners who are in same field, who have same thought process, blending their thought, doing well. And so this not only focusing on traditional learning, only not only the optical phenomena, only not the 6 by 6. It focuses more oftenly on the research factor, the vision rehabilitation factor, and the all the awareness factor. So, Brajesh sir, are you audible? Am I audible to you?
Am I audible?
Yes, sir. Yes, sir. Sir,
So good
so
morning,
how are you
everyone.
feeling? Good morning, sir. How are you feeling today?
I'm fine.
Sir, so my first question, on behalf of all the community, that maximum of us know who actually is the Brajesh sir. So, what are your uh, experience? What are your journey starting from the initial day when you were like a child in 11th or 12th? What makes you pop out that thought to pursue that course optometry in 2 decades before? And from that time till now, what is your experience?
Okay, first of all, I'd like to thank Adnan and Neuroptech team for inviting me to be present in front of all these optometrists, young optometrists who are just starting their career or who are in the process of building their career. So Neuroptech team is doing a wonderful job by bridging the gap between the optometrist and knowledge learning, because most of the optometrists are very keen in learning, but they are not getting any platform for getting their practical exposure, which they are doing in theoretical classes in their colleges or universities. So thank you, Neuroptech team, for very good initiative. Now, regarding my journey, first of all, I'd like to say it was not by choice. It was just by chance. So I belong to Bihar, and like other families in Bihar, my parents also wanted to go from me to go for a government job or a medical or engineering, but unfortunately the things not went well. So one of my father's superior advised him to send his son for the optometry field, this field. So he suggested me to explore this field and join this field. Then I took admission in the for my academic a bachelor's in NSHM Knowledge Campus, Durgapur, where my academic foundation was built, where faculties make me learn about the basics of optometry and all the academics foundation. The most and real transformation came in my life when I joined Shroff Hospital at Delhi. So Shroff is one of the best well-known hospital in the field of eye care as well as optometry training. So in 2008, our seniors suggested that those who will top the class, they will go for optometry training at Shroff. So so it was a challenge for me, and I took it, and fortunately I got to have my training placement at Shroff. So Shroff is basically a place where students come as raw. They just have theoretical knowledge but don't have any practical exposure. So Shroff is the foundation place where the students get much exposure about the clinical knowledge, patient care, diagnostic procedure, specialty clinic, even non-clinical areas also, and also co-managing optometrist role with the ophthalmologist and other department also. So the initiative of Shroff is to basically to develop a basic professional into a professional clinicians. So when I joined Shroff, it was not as a Shroff optometry group. We created Shroff as an optometry family, where the all the students get their learning experience within their family members, because they are much more open for discussion, learning. Earlier, the students who don't know anything, they just hesitate to learn. कि sometimes they say that जब मैं पूछूंगा तो लोग डांटेंगे, अच्छा नहीं लगेगा, that's it. So they, at that time they get very hesitant to learn, but we created an environment where the patients as well as the trainees feel safe, that they are in the safe hands for good learning, and ultimately they get transformed into a basic clinician to a professional expert in the field of optometry. So this was my basic journey, and Shroff is really a good place to have learning, which transformed me. And right now, I did my training from Shroff. Then I joined as a faculty. Now I am educating so many young student, young optometrists, and transforming their career. It is challenging, but still it is very good, and the feeling is very good for the mentoring all the students and making them transforming to be a good clinician in this real world.
Yes, sir. You have mentioned that like people डरते हैं कि कैसे पूछे. So I have a question that how can we contribute the interdisciplinary collaboration between the optometrist and the ophthalmologist? Like I also, when I was in my second year, I used to get afraid that if I will do something wrong, this and that, ophthalmologist will scold me. How can I connect? And this create a barrier between both, and which results in lack of patient care, and the best outcome which we can do is lagging behind. So what can we do to avoid this, and what can we do to overcome our fear factor?
Okay, there are two aspects. First of all, we used to live in a family right from our childhood. So we always be under the guidance of our parents. We like mummy more, father less, because father used to scold us. और हम डर के जाते नहीं है वहां पे कि हम पूछेंगे वो डांट लगाएंगे. But still later we realize that the teaching made by the parents, either it is mother side or father side, is the best learning which we carry out throughout our life. Similarly, in optometry, when we start our career, we take ophthalmologist or our senior faculty or even our senior colleagues as a mentor, which we feel free to connect so that we can have learning. And scolding is not a part of that. They are abusing us. That is basically they are transforming us into a professional clinician, because that time we feel that this is a scolding, but later we realize that that was the for the benefit of our transformation. Because जब तक डांट नहीं लगती तो तब तक वो चेंज नहीं होते. जैसे होता है ना, सोना को तपा के पिघला के तभी सोना बनाया जाता है, तो वैसे ही transformation is necessary, that we don't take it as abusing or scolding. We take it as learning for the future. So similarly, we don't have also any competition from other departments. Sometimes later on we realize that ophthalmologists are stopping us, or any other streams are stopping us to learn. No, it is not like that. They are always helping us to grow. to enhance our skill and upgrade ourselves every time. So if they scold, it means they want us to upgrade to the next level so that we can do much more better, and which should be in turn beneficial for those ophthalmologists and also for the patient care. So they want to make us to the reach the next level. So the patient care should be much more efficient, and the hospital should be, or even organization should be more productive.
ओके, सो मीन्स फटका ज़रूरी है थोड़ा सा ताकि today
आजकल you have heard of Gen Z, वो
yes sir
बिना डांट के बिना तपाए सोना पिलाए सोना बनता नहीं है. इसके लिए you should have to get scolded repeatedly, because होता है ना, डांट का असर 1-2 हफ्ते होता है, फिर दोबारा डोज जरूरी है.
हर 2 हफ्ते में ज़रूरी है ताकि वो ट्रैक पे रहे.
Yes.
Sir, for our viewers, I would like to mention a question by the story. So there was a boy who used to be scolded every day. Oftenly, he used to be punished. He has poor performance factor, lack of study interest, lack of listening abilities. He used to play only games, lack of attention. He totally has poor literacy performance. He used to be get E grade oftenly. And what makes him to be immune of the insults people used to give him, and at some point of time he get a tragic experience which actually makes him to just do or die. For example, he was like a bird who was on the peak of the mountain and he has only option left to jump. Either he can fly or he can die. So, what my point is, now in today's era, we majority of know that Brajesh sir is a mentor, a educator, a clinical expert, a clinical in charge. So, what makes you, what tragic experience actually made you the Brajesh sir we know?
If I talk about my starting journey, it was in 2008 or 9. At that time, we have seen that phase when we come from our college, when we travel in our train or goes to our village, and someone asks what you are doing, which course you are doing. So then we used to say that we are in the optometry program, and later on we will go to become as an optometrist. So that was the phase when the people don't even used to able to pronounce the word optometrist. They used to say optimistic, what opta
Yes,
kya.
yes, sir.
So that
Today's
time we have
optometry.
seen that phase. They were not even able to pronounce that word. But gradually, by the awareness of the optometry program and the role of optometrist, and even they used to ask whether you are a doctor or a compounder or assistant or a technician. So that time we don't have any answer, because that time scopes were limited, or either we were not aware of the scopes. But later when I came to Shroff and explored the scopes, and we saw the role of optometrist, surely our faculties and in charge have transformed the optometrist role in several other areas also. So just beyond the prescribing the glasses, we have moved a lot. So gradually in 10-20 years, the transformation has begun, and we have already enrolled into the specialty OPDs, co-management with the specialty clinics, even diagnostics, pre and post-op care, and even at present times, optometrist role has extended to several other areas like research, eye banking, community, because most of the time people don't used to go back to their hometown after studying at a urban area or a high tier 3 tier city like
Yes,
Delhi.
sir.
So the people there at village do not get the proper care. They just got screened by some technician or early people who just get basic education, and for moving out for the treatment to the Delhi like city, they have to bear the cost, so which is very difficult for the patients. So to make that reach to that level, we have also to invade into the community field. So optometrists should play a very important role in the community by doing their community optometry, teleophthalmology, and there are several areas, other ocular diagnostic or screening programs, so that they can screen the patient, and out of 100 you can refer 5 those who actually need the treatment. So we can play a very important role. So we have seen those phases of transformation from like 20 years to 10 years. And at my training time, the challenges that I faced actually, during the training that we are not aware, we are not exposed to that advanced techniques. Faculties are supportive, but we don't have that basic knowledge. So everything I try to transform, and currently I try to address all those problems, so that the students who are coming into the training program or anything, they should get much benefit, because there is a platform, there is a faculty or mentor, there is a keenness of student, but there is no collaboration or connection between all these. So the student just remain underperformed in every areas. So all this transformation has occurred, and still we have much more beyond to go. So optometrists are doing independent clinics, they are managing patients, they have a independent practice, right, like dispensing part, like primary care, screening, referral. So optometrist is playing a very important role in all these areas.
Okay, so sir, as you said, like in last 1 to 2 decades, much things are being changed and things are being evolving, especially when the COVID has been come.
Yes.
Sir, what more an optometrist can do to evolve himself as a whole community, so that the optometrists who are Indian optometrists, as compared to other the UK and USA, where they have a specific course other than optometry, like bachelor in ortho optics, they
Yes.
used to learn LASIK. Sir, I'm not telling that we are so much lagging behind, but due to our conflictory self uh, decisions, self issues, how can we rather collaborate other than competing, so that we can do more better in next 10 to 20 years?
So first thing is that we are underrating ourselves. When I joined this profession, it was but by chance. But when I join, then I make it my choice. So you should always feel, you should be proud to be an optometrist, not competing with other professional like physiotherapy or ophthalmologist or anyone else. So your profession is your profession. Make that profession count. So first of all, you should feel proud to be an optometrist, and sometimes we are getting feared, like some technicians or some instrument or some AI or some diagnostics will replace us. So we don't feel scared that they will replace us. They are just machines, or they are just your subordinate or your helping hand. So you consider equally for all their roles, and take help from all their roles, and provide the best possible care. So starting from the 20 years back, we started with just dispensing, just prescribing glasses. Then we moved on to the clinics, like co-management with the ophthalmologist. Then we moved to the independence clinic, like contact lens, low vision, dispensing or opticals, and even other clinics also. Then we advanced to different diagnostic, ocular diagnostic, where we have done helping an ophthalmologist to confirming a diagnosis, and also for the management part also. And similarly, at the same time, we are also promoting the task shifting. Task shifting means, if you are doing the basic workup, the primary workup where the patient needs, the ophthalmologist will get much more time to shift to their higher specialized job, like surgery or specialized cases. So the patient will benefit much more. And similarly, in future also, there are several fields like AI, machine learning, diagnostics, neurooptometry, orthoptics. These are the highly advanced field which will be taking as a revolution in our optometry field in future. So earlier we are concerned only about the eye, but eye is not related to only eye. It is related to brain, it is related to communication, it is related to presentation, it is related to counseling of the patient. So everything, it is collaborating. Similarly, the future of the optometry, we are thinking, we are just prescribing glasses. We are not just prescribing glasses, we are changing the life of the patients. We are just transforming their less vision to live their independent life with their independent capabilities. So we are just explaining them to use their capable vision or residual vision or capability that is inbuilt them, and just promoting them to live their independent or do their independent tasks. So in future, there are very much scopes, like optometrists are moving to management part, to quality part, to providing best care, to eye bank, to community ophthalmology, to neuro optometry, to myopia management, and several other fields. So optometrists are playing a very pivotal role in changing the eye care. So they should work with an ophthalmologist. They should coordinate with other field like physiotherapy, neurologist, everyone, and should provide the best possible care to the patients.
Okay, sir. As I tell that I also did my third year from Jamia Hamdan. Sir, including many of the students who weren't get the opportunity to learn from a high respected institute like Dr. Shroff Charity Hospital. Sir, they used to be get confused how to manage the theoretical part and practical part. Actually, they used to differ these two, and which results in lack of knowledge. Also, they didn't get the clinical full exposure, as they used to say that we can't balance both. And sir, how can we get to arrange these two things? How can we say that these two are not two different tasks? Like these, you learn to apply, you apply to learn more. And how can we connect this chain, sir? According to you, if our viewers, they are maximum of ongoing bachelors, and they used to get confused how if I can do this, I can't do this. If I manage this, I can't this. Sir, to learn if they didn't get a chance to get from in Dr. Shop or LV Prasad, any of the greater institutes, by any of the reason, what other factor, what other things they can use to be motivate themselves so that they can learn and they can do all the things, the clinical practice things and the theoretical things combinedly to give the best of them.
Sure, but the main thing is that perception comes from within yourself, because we are joining a program. Sometimes they feel that they are forced to do that because they have no other choice. So if you are forced to do, make your choice, and then transform the your career according to yourself. So if you are going from any university, or currently the education system is not uniform throughout the country. So all the students who are enrolling into the bachelor's or optometry program are not getting the same level of education. So the first and foremost criteria for a basic clinical skills to be developed is your theoretical knowledge should be appropriate, because no one can teach you until you know the basics. अगर आप ABCD नहीं जान सकते हो तो मैं आपको sentence या word नहीं सिखा सकता. So basically you should start to uplift yourself by uplifting your basic knowledge education. That should be the foundation of your training. Until and unless you don't know the basics or don't know the foundation, even we can't teach you. So if you are coming by choice, if you are coming by chance, or if you are forced to come into the profession, make this profession your choice and work for the betterment of this, and at least build the foundation which should be lying within you throughout your life. Because अगर आपने एक बार फाउंडेशन बना लिया, आपने नींव रख ली, तो वो नींव आपसे कोई नहीं छीन सकता. So you are not getting a theoretical education and you are doing practical. After doing 5 years of clinical practical, you might be able to do that procedure. Suppose you are going for a retinoscopy or any other procedure, you are not knowing the basics. आप 1 साल 2 साल करेंगे वहां पे, you will be able to do retinoscopy. But in case of complicated cases, when it comes behind the background of the foundation, you will not be able to tackle those patients. So education learning should be uniform for everyone. But जब challenging cases आएगा, तो that person who will be go out of the way, building his foundation, doing the clinical practice, only that person will be able to tackle those cases. So education should be uniform, at least minimum level, to have a clinical exposure and clinical training. So even we think that मैं श्रॉफ में फेलोशिप के लिए जाऊंगा या मैं श्रॉफ में ट्रेनिंग के लिए जाऊंगा, मुझे सिलेक्ट नहीं किया जाएगा. क्यों? You are doing a 3 years of course. You must have some basic knowledge. अगर आपके पास knowledge है, you have confidence, you have the desire, you have keenness to learn, हम क्यों रिजेक्ट करें? We are here for train other peoples. अगर आपने optometry ज्वाइन कर ली है वहां पे, तो आपको आगे अपने फ्यूचर में अपने आप को डेवलप करने के लिए एक अपॉर्चुनिटी मिलेगी, and Shroff is giving that platform. But you don't know the basic, we will not select, क्योंकि हमारे पास time limited है. You have 12 months, you have 18 months. So within that 18 months, we have to cover all the postings as well as training. So मैं ABCD से start करूंगा वहां पे, तो मुझे 10th पास करने के लिए 10 साल लगेंगे. तो मैं श्रॉफ में 10 साल की ट्रेनिंग नहीं करा सकता. So at least you should have some basic theoretical knowledge, basic foundation training, so that we can enhance your skills to clinical skills, so that you can tackle the patient very well.
You have mentioned like in retinoscopy the complex cases. Sir, for our viewers, can you mention some of the complex cases which makes retinoscopy a bit more confusing or challenging?
even a simple retinoscopy is complex. Those who have not holded the retinoscope, because most of the time when we take an interview or take other people, so we think that retinoscopy is easy, koi bhi kar leta hai, AR se number aata hai, we can take out the number. But retinoscopy is the most complex procedure within the optometry part. If you are mastering a retinoscopy or if you are expert in retinoscopy, 90% of the patient diagnosis or 90% of the patient finding you can detect or even screen with the help of retinoscopy procedure, because the steps include history, refraction, and acceptance. All these three steps combinedly address almost 80 to 90% of the case or the problem for the patient, and at least you can guide the patient and ophthalmologist for the proper management plan. So बहुत लोग सोचते हैं वहां पे AR से नंबर आ गया, रेटिनोस्कोप से हमें आ ही जाएगा, रेटिनोस्कोप क्या है, 1 महीने 2 महीने सीख के आ जाता है. बट इवन आपको एक प्रेसबायोपिक नंबर निकालने के लिए यू हैव टू बी मोर at the same time similar expert to a person who is doing a keratoconus refraction, because if you don't know the end point, you are not able to find the number. If you are not able to cross check the end point, neutralization point, you are not able to make the correct prescription. So retinoscopy is a simple process, but it is very complex and it needs expertise to learn. So the other complex cases, like if you have high astigmatism, if you have keratoconus, if you have mentally retarded child or a pediatric population, in that you need mastery or experts to have a correct, accurate number. Because mostly elderly patient, you can verify the retinoscopy value by acceptance. But in children, everything depends on you. If you are doing a wrong retinoscopy, next time patient will come with a complaint and you will again have to prescribe the new number. And suppose, for an example, if you are purchasing something, suppose आपने कोई dress लिया or some particle or article आपने लिया, you want that to be used for a 6 months or 1 year. How can you expect a patient to buy a glass and change his glasses within 1 month? So it is not acceptable. So the refraction and the clinical finding that you are doing should make a stable statement if there is no intervention or no any change according to the patient complaint or sign or symptom. So complex cases can be anything, like you have a high hyperopic number, aphakic correction, or a high cylindrical number, keratoconus case, oblique astigmatism, or any irregular corneas, or you have corneal opacities, or even high degree of PSC. So these are some complex cases you need expertise in retinoscopy.
Sir, so before moving to our main theme, optometry beyond 6 weeks, the last question and the most important one, which according to me, sir, in rural areas, as we know, optometry in India is more oftenly having only the English medium to study. And sir, in rural areas, this is a major language issue, a language barrier. Sir, community like Neuroptech and many others who want to contribute to the optometrist, sir, how can we manage or we advance our things so that we can give majority of the students who also want to be learned, who weren't any awareness or guided for this course? How can we spread optometry pan India in each state?
Actually, it is our hesitant ability. So there is nothing called barrier of education, Hindi or English. So Neuroptech is doing a very wonderful job. You are bridging the gap between education and the students who wants to learn. So my advice will be the most important: participation. Because if you try, either you fail or you succeed. If you don't try, you will fail only. So my advice should be the active participation from all the students. Don't hesitate. What will happen? You will be scolded by someone. आपको लगेगा कि मुझे वो बोला गया, I am at low level, मैं inferior हूँ. But after 10 session, 12 session, you will feel that I am growing into that part, and I am going to be a part of this community. So even in other apps also, like you can see in advertisement, yeah, there is Seekho app. आप हिंदी सीखें, इंग्लिश सीखें, तो why can't we do in optometry also? We can integrate both Hindi, in English, all student, everyone. Learning is not a never-ending process. So learning can be done to anyone and by anyone. So if you are doing and something, if you know something and if you are not able to make someone learn, your knowledge is waste. So if you know something, you should impart your knowledge to the person who don't know. So there is nothing called high or low level student. Everyone is at the similar level. Sometimes the weaker students need more attention, and you should more focus so that they can uplift themselves to the upgraded level. So optometrists should be at par level. They should upgrade themselves, and the most important thing, they should not hesitate to learn. Just come forward, participate, learn, again grow.
Yes, sir. Sir, like any implementation, any idea without implementation is just an idea. So without execution, a knowledge is just a knowledge.
Yes.
You can't. If you weren't able to spread the knowledge, no one will more aware. And the sir knowledge means एक जो pathway है जो बांटने से ज्ञान बांटने से बढ़ता है, जैसे हम मानते हैं.
And I want to quote one thing. Our one of the faculties shows that you are an optometrist, and if you are not able to speak, because earlier the people used to hesitate, मैं तो रेटिनोस्कोपी कर लूंगा, वैल्यू भी लिख दूंगा, स्लिट लैम्प भी कर दूंगा, लेकिन पेशेंट को कैसे बताऊं, वो तो 4 क्वेश्चन पूछेगा, मैं डर जाता हूं. So that time we are very hesitant कि पेशेंट पूछेगा तो मेरा क्या होगा वहां पे, मुझे नहीं आया तो क्या होगा, वो हंसने लगेगा वहां पे. So that time you don't feel hesitant. Our faculty used to say that you are an optometrist. If you are not able to speak, then what you are doing? Like अगर आपने किया और आप उसको बता नहीं सकते और आप उसको समझा नहीं सकते, तो आपने क्या किया? भले ही आप करने में बहुत अच्छे हो, बट द डिलीवरी, अगर आप उसको डिलीवर नहीं कर पा रहे और जिसके ऊपर आप कर रहे हो, ही इज नॉट रिसीविंग, so that means your clinical skills or clinical finding is not imparting it, not justified. So you should be able to express yourself, speak, explain to the patient, whatever right or wrong, you can go ahead. मैंने पहले ही बोला, if you are trying, either you succeed or fail. If you are not trying, you are always a failure. So always participate, always take initiative, and always have the chance to either succeed or fail. And we all know that failure is the path of success. First time you will feel this was wrong. The second time is a learning for you that this should not be done. So that is the pathway for the growth. You will be gradually moving to the success, and ultimately after 6 months, 1 year, you will be able to deliver the things that you are doing to the patients.
Thank you, sir. So now we are like to move to our main topic. Fortunately, we will connect more in future.
Surely
So now
anyone can connect to me, and for any query you can drop in a message, or anything you want to ask related to optometry or training. I'm always there, for everyone to help.
So now moving to our main theme, vision beyond 6x6. So moving to Shazia. Thank you.
Thank you so much, Adnan, for such a beautiful start to this podcast. And thank you so much, Brajesh, sir, for being so relatable. Because personally, I also am from Bihar, and there is a norm here that either this child will do civil services, will go for railways and government examinations, or either they'll tell them become a doctor. So
Yes.
I, as well as a lot of people, have come into optometry just by chance. But I can say this for sure, and I think I'm speaking on behalf of everyone present here, that we are absolutely loving this field. We are absolutely loving what is happening, what we are doing. And another thing that you said कि आपकी delivery अच्छी होनी चाहिए, because no matter आपके पास कितना भी knowledge हो, आप कितना भी ज़्यादा जानते हो, अगर आप patient को वो समझा नहीं पाओगे, आप बता नहीं पाओगे, तो वो जो bookish knowledge है ना, वो वहीं पे धरी की धरी रह जाएंगी. So on that note, I'll like to start the next segment. And in this segment, we'll dive a little deeper into the academic and clinical side of optometry. Sir, I'd like to begin from the very basics. During our early clinical years, we are taught that 6/6 is the gold standard of normal vision. But in practice, we often see patients who achieve 6/6 and still complain of discomfort or lack of clarity in such situations. Even though the refraction seems perfect, but we know that theoretically it is perfect, but something is missing. So what exactly is happening in these cases? How should an optometrist evaluate and manage this kind of patient? What parameters beyond 6/6 should we consider to achieve a truly accurate and comfortable prescription?
Okay, so this is a very relatable question. Most of us come across this in our OPD when we do our refraction and complete the acceptance. The patient is able to read the last line, and but last में वो उसका statement होता है दिख तो रहा है लेकिन मजा नहीं आ रहा. He is used to say like this कि
Exactly.
वो छोटा लाइन दिख रहा है लेकिन वो मजा नहीं आ रहा वहां पे. तो first of all, we need to go for an accurate refraction because currently in last 5 years or 3 to 5 years we consider that something an optometrist is overconfident. मैंने जो किया that one is correct. So we should go for a acceptance, best acceptance that the patient is accepting. My refraction value is whatever is coming, that is a starting point, but the final end prescription should come from the patient end. The best acceptance should be accepted by the patient. So we should not miss any cylindrical or axis or any power. First of the accurate prescription is necessary. Even if the prescription is correct and still the patient is complaining कि वो मजा नहीं आ रहा, then we should look for other aspects, because 6 by 6 is just a number. Because we in book we have read that the normal vision is 6 by 6, and we have designed a chart and asked the patient to see the letters. So it is just a number, but the actual condition, the comfort, the satisfaction depends upon the patient, whatever he is requiring. His expectation is what. So we should go for some. There might be some squint present, there might be some dry eye problem, or the computer habits that the patient is using should not be suitable. And sometimes the contrast is also there, a factor will also be there. So we should go for addressing these conditions, like if patient is having any squint or any binocular dysfunction like accommodation or convergence, we should go for the correction of those accommodation and conversion anomaly. If the patient is having any surface disorder, ocular surface disorder like dry eye, the patient is using laptop or computer for 8 to 10 hours, then we should ask the patient to give breaks in between, encourage the blinking time or the 20-20-20 rule, or even ask the patient to go for artificial drops. So we should address all these things. And in case of uncorrected or any phoria, we can also go for a prism correction, small prism correction, so that the patient should astronomic symptoms should be relieved. So 6 by 6, we don't assume 6 by 6 to be normal. We should address other factors which make the patient comfortable with that vision. So we should consider all these factors for a better vision and better comfort for the patient.
That's such a valuable insight, sir, especially for students who often treat 6-6 as the final goal rather than the starting point for understanding visual performance. I really like how you highlighted the importance of assessing functional vision, because that's where real clinical skills begin. And that actually brings me to my next question. Sir, as technology keeps advancing, we're seeing incredible tools from automated refraction systems to digital slit lamps and whatnot. But despite all this innovation, optometry still remains a very human driven profession. So, sir, in your opinion, what are those core clinical skills that every optometry student must master? The kind of skill that no technology, no matter how advanced, can ever replace?
Basically, currently the world is changing with digitalized and advanced diagnostics. Suppose diffraction is done by AR or high-end machines. Even portable cameras are also available, who used to screen the patient with any retinal pathology or anything else. So everything is digitalized and modernized. So, but still the optometry and its clinical skills needs a human touch, because basically machines can do the test, give the result, that is the data, but they cannot interpret. So until and unless a clinician is there, he is able to interpret those results and communicate the same to the patients. So that will be valuable. If you are doing a reading, one के साथ one आया, number दे दिया, उसको समझ ही नहीं आया, then you will say that आपका नंबर ये है, ये सिलिंड्रिकल है, आपको ये रिक्वायरमेंट की जरूरत है, आपको ये सारी चीजें, आपको ये प्रिकॉशन लेनी है वहां पे. तो all these things that need a human touch, that should be done by an optometrist. The clinical skills that we already know that optometrist main skills is retinoscopy, acceptance, slit lamp, eye applanation tonometer, and the counseling and communication for everything. Because machine can do the test, like it will screen the patient, but it will not communicate. You can correlate what the patient is complaining of, what the patient's finding are, and then what the values came, and then you will correlate everything, and then you will communicate the patient, you are having this problem, this test has done this report, and ultimately you are with the this diagnosis, and your management plan should be there. So optometry needs a human touch. Without human touch, the machines can give you additional information, and that information can be imparted by an optometrist to the other patients as well as clinician, and that will act as a record. So we do not need to be afraid by a machine or anything, any other diagnostic, because mostly we get hampered. अरे यार आ गया हमारा रेटिनोस्कोपी का क्या होगा, हम क्या करेंगे, स्लिट लैम्प पोर्टेबल आ गया, कम्युनिटी में चले गए, व्हाट वी विल डू. So we should not be afraid, because the touch, the empathy, the complaint, the treatment depend upon person to person. That the machine will do test uniformly to all the patient. But as an optometrist, you need to customize all the finding, all the treatment according to the patient, understand their need, and then address those problems so that the patient can be satisfied.
Yes, sir. That's such an important reminder, because sometimes we rely so much on automation that we start losing the essence of clinical judgment and observation. Now, as we're on the topic of judgment and decision making, I have a very important question for you. One thing that often confuses students is choosing the right academic and clinical path ahead. Some students want to pursue a master's in optometry, while others lean toward fellowships. But we often don't know what suits whom or when is the right time to go for each. So, could you please guide our attendees on who should ideally go for a master's degree, who should consider doing a fellowship, and in which clinical areas are fellowships truly fruitful in today's scenario?
So that should be not an answer from my side. That should be answer from all the participants, because it's totally dependent upon the interest of the individual. Suppose I have a passion, I want to become a cricketer और मुझे फुटबॉलर बना दिया गया, 3 idiots, जिसको जो करना है वो करो वहां पे, go for that. So whatever you want to learn, you have the passion, go for that. So you have an interest in the academics, you want to go for research, you want to go for pursue higher studies, then you go for a master's program, because earlier you need to bachelor's, have master's, then PhD, and then you go for a teaching experience as a professor or as a lecturer. And if you have a passion for clinical areas, for patient care, direct connection with the patient, and you want to enhance your clinical skills, then you need to go for a fellowship. But in both the condition, you should choose the right place, because there are fellowship offered 500 places, and you just go and standing 1.5 years, 1 year, and you don't need to learn anything. You just are standing behind a senior doing their basic works, because you are a helping hand for them, and you complete the fellowship and you get a degree. So you must choose a ideal institution where your passion and your expectation meet, so that you can get the more clinical skills, diagnostic skills everywhere. So it totally depends upon your interest and passion, which area you want to select. For academic and learning, you want to go for a master's, and for clinical and patient exposure, patient learning and clinical exposure, you should go for a fellowship from a good institution.
Okay, I think that has cleared a lot of doubts from our attendees. I think please mute your mics, everyone, for a smooth experience. Okay, so I think that has cleared a lot of doubts, because जैसे जैसे इंटर्नशिप करीब आती है, वैसे वैसे फ्यूचर को लेके स्ट्रेस का हाई होता जाता है कि what is it that
I just want to quote one more thing. When you are in the third year के बाद आपके दिमाग में सारे ब्रेन्स के सारे नर्व्स काम करने स्टार्ट होते हैं. वो ये कर रहा था, उसका कुछ नहीं हुआ, क्या करेंगे. वो ये कर रहा था, उसका देख के क्या करेंगे, उसका भी कुछ नहीं. वो ठीक कर रहा है, उसके पास जाना चाहिए, लेकिन मेरा इंटरेस्ट ही नहीं है वहां पे. एंड द अल्टीमेट फैक्टर इज दैट करने के बाद होगा क्या. कहीं हॉस्पिटल में जॉब करेंगे, 20-25 हजार की सैलरी दे देंगे वहां पे. किसी कॉर्पोरेट में जाओ, वहां 50,000 देंगे वहां पे. किसी और अपना क्लिनिक खोल लो, पहले नहीं चलेगा फिर चलेगा. देयर आर सेवरल डायलेमास इन द माइंड्स ऑफ मोस्ट ऑफ द यंग इंडिविजुअल्स हु आर डूइंग इन देयर बैचलर्स एंड इन द थर्ड ईयर और फोर्थ ईयर. But you should, I already said that whether you are going into the optometry profession by chance, by choice, or you are forced to, make that choice and you feel proud to be an optometrist, because you are the one who can lead the pioneer. You can make a path for others to follow. So there are several scopes. You need to explore their scopes. Don't get panic, because after completing the optometrist, सबसे पहले आपके पास एक एग्जाम्पल है. No one is sitting idle after doing optometry. कोई एक पर्सन है कि जो बैठा हुआ हो, ऐसा कोई भी नहीं है. अगर कोई बैठा हुआ है तो इट्स योर चॉइस, वो अपनी मर्जी से बैठा है. So no one is sitting idle, but the thing is that you need to grab the right opportunity, because हम क्या होता है, कभी कभी क्या होता है, वी डोंट गो आउट ऑफ द कंफर्ट जोन, हमें ये काम भी करना है, पैसे भी चाहिए, ज्यादा मेहनत भी नहीं होनी चाहिए, एवरीथिंग। समटाइम्स यू लर्न एंड कि मुझे वहां जाना है, यहीं चल रहे हैं, साल भर चल गया, यहीं रह जाओ। कुछ नए जगह जाएंगे तो 20,000 30,000 इंक्रीमेंट होना चाहिए तभी जाएंगे, काम भी कम हो जैसे पहले करते थे वहां। तो एवरीथिंग दे कोरिलेट, सो यू कांट गेट एवरीथिंग एट ए टाइम। So you need to build a gradual path, and you need to set an example for everyone so that they can follow you and you can upgrade yourself to the next level.
Exactly. The most important thing is whatever you do it from a place which has recognition. First thing, you have to be passionate about what you're doing, as don't get stuck into it. I think a lot of people have cleared their doubts regarding this. Sir, since we're talking about different specializations, how optometry is expanding beyond traditional refraction and anterior segment work, there's one area that's gaining remarkable attention lately, that's neurooptometry. So, can you please share your perspective on the role of neurooptometric rehabilitation in India's clinical optometry practice?
Currently, like in Instagram's reels, you say the trending. So earlier, 2 to 3 years back, the myopia management were trending. Currently, that neurooptometry is trending because optometrist and patient care is moving from eye to brain. Because earlier when we are focused in the eye, refraction, glasses, diagnostics, and patient care, detection, screening. But how the eye is normal, but still the patient is not normal. So that is the relation between eye and brain that can be suspicious, who can create a normal eye with abnormal behavior of any child or any person. So there is something wrong with the connection between brain and eye. So that neurooptometry deals with that. So currently, most of the cases, the person is clinical findings are all normal, but still his behavior is not developed, and everyone who is not responding at other with like other person at this of the same age. So neurooptometry is trending in current times, and future also it will go beyond. So the connection between eye and brain should be explored. Like if you see, it is perceived as that thing, but how that perceiving, that connection, visual pathway connect, you see that is perceived by presented on the retina, it is transferred to the brain transform that signals, and then tells the eye you are seeing this thing. So that perception, that attention, everything, that all those parts is connected in the neurooptometry. So neurooptometry is currently very important, and it is very growing rapidly, and in future it will be a very good area to explore. And currently we have very few people who are exploring neurooptometry. So I would
True
like to
that.
see most of the people here, they should select neurooptometry as a career. So that is another scopes in future that can that they can explore and go beyond, and you can make a landmark in that.
Yeah, hi, Sazia. I am Rupali this side, and I'm a student of Brajesh sir also. Sir is knowing me. If if you give me 5 minutes, then I can talk more about neuro optometry. Because I am dealing with CVI, ADHD, autism, and all neuro disorders, along with the comprehensive pediatric and orthoptic binocular optometry also. So yes, sir is truly mentioned everything. He's just like a guru for us, and he's a big motivation to us also. So am I allowed to speak a few things on neurooptometry or
Yeah,
behavioral
sure. Go
disorders?
ahead. Go
Yeah,
ahead.
yeah.
Go ahead.
So, yeah, hi everyone. Myself Rupali. Currently, I am working as a consultant optometrist at Safe Side Center and dealing with the neuro childs also. So it's been 7 8 years like been into this practice, but I feel really blessed that somebody has chosen for me, or I don't know, being into this practice, get to connect with the people, and people all the way from Bangladesh, Bihar, everywhere come to me for the treatment. And can you imagine that child is not following and fixing, suddenly they start responding, suddenly they start they giving you response about, because how they are working, even they don't have vision, they don't have refractive power, everybody's shocked, everything works fine. But yes, Brijesh sir already mentioned that optometry is something beyond glasses. Whatever you are doing, if you're not confident about that, how you can present in front of anybody? So see, I'm working with, very high reputed retina consultant, but he's saying, okay, fine, I'm not seeing this patient. Rupali is seeing these kind of patient. So why so? Because I am representing myself and I am dealing with the patient, and not dealing, I am giving them also. So empathetic and right approach is very important for these kind of patient. So I've just chosen one example. Recently, I've seen one patient. That girl was 8 or 9 years old, and that girl come up with chin down, no refractive error, not very correct refractive error, it was around 1.5. And I've seen 25 and 30 prescription where it mentioned uncooperative child. Because of you cannot perform anything on that child, how you cannot write, you cannot write this child is uncooperative. So what happened, when I start, initially, if any neurologically impaired child come to you, then you need to start with the torchlight examination whether the fixing following is present or not. Because PL plus PR, everybody know that how we need to check. It was not mentioned there, it was mentioned your child is blind. How you cannot say someone? When I've been through the MRI reports, so in MRI there was totally mentioned there is a damage in occipital lobe. So if you have knowledge about that, okay, occipital is responsible for vision contrast and the visual acuity. So when I performed retinoscopy, there was minus 3.5, along with that minus one cylinder. And after putting that cylindrical and the sphere lens into the trial case, the child start responding from down gaze to see, she start looking up. And mother is like कि ma'am, we are not aware about what type of problem my child is having. इसको क्या प्रॉब्लम है हमें समझ ही नहीं आया, बट आज समझ आया that girls is 8 or 9 years, because nobody is able to explain, even with doctors also. Right time, right approach, and right treatment, can change someone's life. And I've changed a lot of light, holding them in a, my lap, and they start going school. Parents are giving me update over that. Ma'am, मेरा बच्चा स्कूल जाना शुरू कर दिया. Very happy to do that. आप मैंने जन्म दिया है और पाला तो उसे आपने, नजर आपने दी, जिंदगी आपने दी. So yes, proudly I can say that I am a optometrist, and whenever I am presenting anywhere, तो people are saying चश्मे वाले. मैंने कहा what, चश्मा वाला become doctor now. So it's a very proudful thing, and we are truly amazing, because we guided by a mentor like Brajesh sir, because few of them are also there. So whatever you are doing, even with the AR also, suppose you don't know retinoscopy, but you are not master in how to prescribe a glasses, what is the accommodative correction, what is non-accommodative correction, you can play with the glasses only, even with the squint, anything. So thank you so much for the time. And truly, neuro rehab is something which you really need to do. Even one child, I think, from Bangladesh, where LVP and so many higher institutes say, okay, there is no vision. Then they came to low vision and seen by Naseem sir. He is also my senior. So I just performed a retinoscopy. There was only five. So that child was CF only. When I give him full plus correction, because plus is obviously prescribed near vision to the child, it becomes CF 3 meter. Just imagine someone is looking here and you are providing the 3 meter vision. It's drastic change in someone's life, and that child is start going. Parents are scared of conceiving second child. They are from Bangladesh, they have now a second baby also, and second baby is absolutely fine. That baby is going to school only. So yes, I feel proud. Does not matter how much company is going to pay me, but yes, I am changing someone's life. That the positive effect about the neuro rehab, and the communication you are making, that a very big impact on something. See, if you are seeing Brijesh sir, I've seen him since, it's been like 10, 15 years. He's keep continue smiling. Does not matter how much stress over him, how much training stress over him. Sir, we are, sir, ऐसा लग रहा है छोड़ के चले जाएं, बहुत दिमाग खराब हो रहा है. अरे ठीक है, chill. It's a part of your life. He's counseling us like this. So who you choose as a mentor, it's play a very impactful. And wherever you go, if you're abhi bhi, I am not in Shroff, but still if I am doing anything good, sir compliments me. So that's doing by a true mentor only. Nobody can do this. So be proud, you are an optometrist. भैया सर्जन 636 दे देगा, बट आपकी आर्ट उसे 618 भी दे सकती है. आपके डिवाइसेस कैन चेंज समवंस लाइफ. आप उसको HM से आप CF 1 meter कर सकते हो. तो be proud whatever profession you are carrying forward. Thank you so
Yes,
much.
yes. Thank you. Thanks a lot. And I think you are an inspiration for all the attendees that we have.
बिकॉज
learn.
सर ने वही बोला कि यू फील स्कैर्ड. मैंने सोचा आई शुड इंटरप्ट और नॉट, बट आई फील कि ओके नाउ आई हैव टू ऐड ऑन सम पॉइंट्स बिकॉज दे ऑल आर स्टूडेंट्स, दे नीड टू बी गेन कॉन्फिडेंस. डज नॉट मैटर फिजियोथेरेपिस्ट डॉक्टर लगा रहे हैं नहीं, बट यू आर डॉक्टर टू योर पेशेंट. सो प्रिपेयर योर सेल्फ लाइक यू आर अ डॉक्टर एंड बी प्राउड. प्राउड से बोलो वी आर डॉक्टर, यस वी आर ऑप्टोमेट्रिस्ट. आप नहीं कर सकते जो हम कर सकते हैं, तो आप हड्डियां ठीक करो, हम लाइफ चेंज करेंगे.
What actually matters in life is you are making an impact in someone's life, you're making a change in someone's life, and that's what is about optometry as a profession. Thank you so much, Rupali. Now let's
Hello,
move on to
hello.
our.
I just
Sajid,
want to
one
add one
second.
more point. So if you are treating a neurooptometry, you are dealing with the connection with the eye to brain, but actually you are making a connection with the heart of the patient and family. So that is
Yes.
the connection you are developing, dealing with eye and brain connection and making a connection with the patient, family, and other members with the heart of that one. So you are
Yes.
transforming the life of everyone.
Truly.
Hello, hello. Good evening, good afternoon, sir. Good morning, sir. I am Mohammad Asad, co-founder of Neuroptech. And good morning, Rupali ma'am.
Yeah, hi,
I
hi.
want to hi, ma'am. I want to add some point here. Basically, I am just graduate हुआ हूँ from a जामिया हमदर्द, and मैंने वहाँ पे इंटर्नशिप के लिए स्रोफ में किया था, but unfortunately मैंने वहाँ पे छोड़ दिया. तो मैंने ये आप एक चीज़ बताना चाहता हूँ कि मैंने वाई आई स्टार्टेड द न्यूरोप्टोटेक. बेसिकली क्या है, मेरी बहन है जो बड़ी सिस्टर है, उसकी एक बेटी हुई है अभी रिसेंटली मार्च में. तो
Okay.
उसका जीटीबी
Asal,
हॉस्पिटल.
I think there's an issue with your voice. Can you please raise it a little bit?
Okay. So now it's audible. I'm audible.
Yeah, you are
Yeah.
audible.
या तो मैम उनका जीटीबी में इलाज चलता था. सो उसका
Mm-hmm.
एमआरआई हुआ एंड आफ्टर उसको हाइड्रोसिफेलस था एंड सेरिबेलम
Cerebellum
एट्रोफी थी.
part is damaged. Yeah.
या malformation था एंड कॉर्टेक्स पार्ट में कैल्सिफिकेशन हो रखी थी.
Okay.
सो फिर हमने यहाँ पे बहुत सारे ऑप्थल्स को, एक्चुअली मैं यहाँ पे दिल्ली था नहीं, सो बहुत सारे ऑप्थल्स को उन्होंने दिखाया. तो
Hmm.
डॉक्टर्स ने ऑप्थल ने बोला कि ये ब्लाइंड है बेबी और उसको कुछ दिख नहीं रहा है, क्योंकि वो फिक्सेट नहीं कर रहा था.
Yeah,
तो
true that. Hmm.
या मैंने आपका ना लिंक्डइन प्रोफाइल देखा एंड यू राइट अ सीबीआई स्पेशलिस्ट, सो
Yeah.
आई लर्न अबाउट द इट. सो मैंने कुछ ऑनलाइन सर्च किया एंड देन एक लिटिल लाइट एकेडमी है, वहाँ पे एक सर्टिफिकेट कोर्स था, मैंने उसको पढ़ा और समझा कि कैसे. तो काफ़ी लंबा कोर्स था, मैंने वो सारा अटेंड किया एंड देन फिर मैंने समझा. फिर मैं घर आया और फिर मैंने मतलब मेरी बहन की बेबी को मैंने उसको एग्जामिन किया. सो आई सी द शी फॉलो ओनली वन गेज, मतलब बेसिकली वो राइट साइड देख रही थी एंड कलर प्रेफरेंस कर रही
Yeah.
थी.
Yes,
तो
true
मुझे
that.
वो डायग्नोस हुआ कि वो सीबीआई है. पर जब मैं
हाँ.
आप सरोफ लेके उसको गया, आप वहाँ तक चले गए थे.
हाँ.
तो क्या, तो फिर मैं वहाँ पे ज्योति मैम है एंड और जो अभी वहाँ पे ट्रेनर कर रही थी, मैं उनको दिखाया. सो अभी उसका वहीं से ट्रीटमेंट चल रहा है. तो फिर मतलब उस टाइम मेरे को पता लगा कि या समथिंग की कुछ ऐसा है. फिर देखा
हाँ.
कि वो ऑटोमेटिक उसको डील कर रहे हैं बेसिकली इस काइंड ऑफ मे बी जो, क्योंकि डॉक्टर्स ने तो साफ बोला था उसके जो
Yes,
पेट में दी
because
थी.
because they are saying cerebellum is a part of brain which is controlling your motor, activity,
या
whatever you are picking, your everything coordination. So suppose you are saying that your sister's child is having one side of gaze vision. So one side vision that we are taking as a positive aspect. Okay, fine. This is a field from where slowly you can start giving brighter object, because our brain is responsible and phobia is responding for the red red color more higher than the other colors. Because in
या
slit lamp, in anything, if you're seeing, there is a target of red color. Even with the poor people with the poor vision also, they can recognize the red because of its higher frequency and wavelength as per your physics aspect. So if you feel anything, you can come to me. I love to help these kind of child, okay, with no consultation, zero fee. So this is how we connecting each others, okay. So I've seen one child, her name is Karthik, and 40-45 years parents उन्होंने conceive किया था. And his father called me 1 month ago, ma'am, मेरा बच्चा नहीं रहा कार्तिक. So मतलब I feel so bad. मतलब even being into this practice, the parents is call me and he feels like I am someone who he can share this feeling, and he's saying, ma'am, if you need anything for a special child for your clinic setup, I will help, because you are the person who are more patiently dealing with all these kind of kids. So even after leaving Shroff also, I am not lefting out my passion for the CVI, even from video call consultation, from anywhere consultation. Even my HOD give me that much preference. Okay, fine, Rupali, if you are passionate about this, you can treat them, and if you feel they cannot pay, you can treat them free. So that much fortunate I am, because अगर वो बच्चा बड़ा होके बोलेगा ना मेरे रूपाली मैम ने मुझे ठीक किया, तो I feel so blessed. And even I am having so many feedbacks video I keep uploading on LinkedIn, where you can see actually they are improving a lot. From no fixing following, they start going school. It just like it's ये तो मेरा बच्चा है. I don't say it's my patient. मैं बोलती हूँ ये तो मेरा बच्चा है. And even मतलब it feels so blessed. So you can come to me anytime for your sister. I don't feel anything. Okay.
Thank you so much, Rupali,
Yeah,
and thank you so much, sir. Yes, sir, do you want to say anything else?
yeah,
Sir?
yeah. But ma'am, I'm audible. Hello.
Yeah, it's a little bit tacky, but you are audible.
ओके, बेसिकली मैं दिल्ली तो नहीं रहता, बट जब भी आऊँगा तो जरूर आपके पास आऊँगा. मैंने मतलब देखा है आपका सब देखता है. तो ये मतलब जब मैंने ये चीज़ देखा तो ये चीज़ इंस्पायर किया कि मतलब ये स्टार्ट करना चाहिए. तो इस वजह से मैंने और अदनान ने ये स्टार्ट किया. हेलो.
There seems to be an issue in the voice.
Rupali ma'am, your voice is not audible.
Rupali, unmute yourself.
ब्रिजेश सर, सॉरी, थोड़ी सी लाइमलाइट आपकी मैंने अपनी तरफ ले ली.
नहीं, कोई नहीं. Most welcome.
But this is the topic which I am talking about, even in my center to the optometrist. Suppose if someone, एक अगर कोई बूढ़ा भी आदमी आपके पास आ रहा है, आई प्रेफर टू स्पीक इन हिंदी ऑल्सो सो एवरीबडी कैन अंडरस्टैंड. तो अगर वो 624 विजन है, जैसे कि ब्रजेश सर ने बोला, इट्स नॉट गिविंग यू 6 but you are not have to prescribe qualitative vision. You have to quantify. Along with that, you have to give quality of vision. Suppose you are putting +3, still vision is CF3 meter, but that image becomes clear. That means you are changing someone's quality of vision. So you need to prescribe. You don't need to scared, अरे मैं दूं या ना दूं, vision is same, जो कि हम नहीं करते हैं. अरे यार CF3 मीटर है, क्यों +5 का चश्मा बनाए? But we have to give, because we are changing quality of someone's life. So this is how we really need to treat. Even myopia, suppose it's become hot topic to all of us. बी ऑल आर ऑप्टोमेट्रिस्ट. घर में पता चलता है, सबको पता चलेगा आप आंखों के डॉक्टर हो. एवरीबडी कम टू यू, बट यू डोंट नो अबाउट व्हाट इज डिम्स इज डूइंग, व्हाट इज हार्ट प्रोग्रेसिव लेंसेज आर डूइंग. हाउ यू आर गोइंग टू एक्सप्लेन? सो यू शुड नो अबाउट प्रिस्क्राइबिंग ग्लासेस इज एन आर्ट. जैसा ब्रिजेश सर ने बोला कि इवन रेटिनोस्कोपी कॉम्प्लेक्स केसेस नहीं, कि रेटिना ऑयल नहीं है सर रेटिना से, तो रेटिना की ही चीजें सर ने हाईलाइट करी, ऐसा नहीं है. सर ने बोला बेसिक रेटिनोस्कोपी इज डिफिकल्ट. सपोज यू आर परफॉर्मिंग रेटिनोस्कोपी बट पेशेंट आपकी रेटिनो पे देख रहा है, तो यू आर परफॉर्मिंग नियर रेटिनोस्कोपी. देयर इज अ एकोमोडेशन बिकम योर फैक्टर. हाउ यू आर मेक श्योर दैट यू आर गिविंग करेक्ट रेटिनोस्कोपी. हमारा तो सर ऐसे, हम व्हेन वी आई एम इंटर्न, सर इज सेइंग कहाँ दिखा रहे हो, पेशेंट तो रेटिनो में देख रहा है. तो वी आर लाइक, वी ट्रेन लाइक दिस. फॉर दैट आपको ये नहीं सोचना अरे यार श्रॉफ में जॉब करेंगे तो वहां तो 20,000 सैलरी है. नो, बट यू आर गोइंग इन श्रॉफ, यू हैव टू लर्न अ लॉट. सो इट जस्ट ऑप्टोमेट्री इज नॉट लिमिटेड. एंड इसमें भी मैं बोलना चाहूंगी, जैसे बहुत लोगों के क्वेश्चन है कि हम एकेडमिक्स में फेलोशिप में जाएं या कहाँ जाएं. जैसा ब्रिजेश सर ने बोला, 3rd ईयर में ना सबके ब्रेन रीवायर होने लगते हैं. अरे यार अब क्या करेंगे यार, लेंस कार्ट में चले जाएं क्या? नहीं नहीं यार, एल्कॉन में जाते हैं, वो ज्यादा सैलरी दे रहा है, वो मेरा दोस्त तो ये कर रहा है. बट आपका दोस्त क्या कर रहा है उससे नहीं, आपको क्या चीज इफेक्ट कर रही है. बिकॉज जब आप फाइनल ईयर तक आते हो तो यू गेट टू नो कि मुझे क्या करना है। ब्रजेश सर को याद होगा, मैं लास्ट कैंडिडेट थी पीडियाट्रिक फेलोशिप के लिए। सर ने मुझे बहुत काउंसिल किया, अरे रूपाली तेरा रेटिना अच्छा है, ये कर ले। मैंने कहा मैं नहीं करूंगी, पीडियाट्रिक नहीं मिलेगा तो मुझे पीडियाट्रिक ही करना है, बिकॉज आई एम वेरी स्टैग्नेंट फॉर माई चॉइस। सो यू हैव टू चूज कि क्या करना है, बिकॉज आई एम फ्रॉम द फैमिली वेर इज लॉयर, एडवोकेट, पुलिस वाला, एवरीबडी इज देयर। I am the only person who is choosing optometrist, not by choice,
Exactly.
not by choice, but by chance. So that's how you need to choose. You know, मैंने NEET clear किया हुआ है. After that also I am choosing optometry.
Exactly. And you are doing so good in this. You're doing so good in this. And but I'm really sorry because of time constraint. I'll have to stop you right now. But it was really,
No problem.
it
No
was
problem
really
at
good.
all.
Now let's move on to the next section. I'd like to call Asad, our co-founder, because and he'll be taking some questions our students have provided. So Asad, over to you. Asad, am I audible? If either of you could take the questions, Asad or Adnan, if either of you could take the questions.
Okay, I think Asad sir का नेट चल नहीं रहा है, so I can continue.
Okay, fine. Adnan, you start with the questions.
Just wait a second.
By the time Adnan starts
Hello.
asking the question, I would just like to say one thing, that conversations like the ones we had with Rupali and the way sir contributed to it remind all of us why this profession is so impactful and how much there is still to learn and explore. And it's been an absolute honor having this conversation with you, sir. Now moving on to Asad.
First of all, before starting the question, इतना तो मैं समझ गया हूँ कि बड़े लोग बाय चांस ही बनते हैं, बाय चेंज नहीं. जैसे
No,
रूपाली
not
हमने
by chance, because in previous time we don't have much scopes, and earlier we have to be guided by our family. तो हमारे पास चॉइस नहीं होता था कि ये लेना है. पापा से पूछा, मम्मी से पूछा, ये लेना है. जो बिहार वाले होंगे वो ज्यादा कोरिलेट कर पाएंगे वहां पे. 10th के बाद क्या लेना है, पापा ने बोला ये ले लो, चलो यही करना है. नेक्स्ट इसके बाद क्या करना है, वही ले लो, यही चलना है, यही करना है. देन ग्रेजुअली वी ट्रांसफॉर्म कि हमने उसको अपना पाथ बनाया. एंड सीइंग द कंडीशन एट दैट टाइम, बहुत सारे लोग बहुत डायलेमा में थे. अभी तो फिर भी बहुत सारे स्कोप्स है तो भी डायलेमा में है. हमारे टाइम पे और डायलेमा में थे. हमारे में यह था कि प्रोफेशन रहेगा या नहीं रहेगा. बट फ्रॉम लास्ट 16 years it is going on, and it is not in the downfall. It is gradually increasing and expanding their roles.
So, sir, there are so many questions, but I will conclude to top 10 questions,
Okay.
which are like similar to each other. So, our first question is, students ये पूछ रहे हैं कि like how can we earn doing optometry, how to take loans, and how to manage all this with study in our bachelor life. First question.
Educational loan.
Educational loan, or since sir, any part-time work, your profession based, how can do part-time job rather than studying in like night shift or taking Sundays, if anyone can want, how to take loans from banks to start any startup, any idea of?
First of all, I'd like to say that during your training or your educational field, don't try to go for an extra earning, because the learning you are getting in first 2 or 3 years, that will be throughout your life. But if you focus on money, that leave this job, leave this training, and then कुछ और कर लो कि थोड़े पैसे आ जाएंगे वहां पे, then your mindset will be in that only कि मुझे पैसे कमाने हैं वहां. Just focus on learning and making you expert or making you learn everything, not everything, but most of the thing that should be helpful in throughout your life. Then go for a permanent job, because you need regular money throughout your month. And then additionally, if you feel that you have shortage of money, then you can opt for several other options like evening clinics or even community camps, because the most important need is in the community. Because most of us are sitting in hospital, in clinics, or in any eye care setup where the patient are not able to come from the far away. So the community camp screening, making the change, making understand the patient importance of eye care, so those your roles are in there only. So you can get involved in those activities. Educational loans, currently we don't have any system for optometrists for getting loans, but you can arrange money, and later on we are working on that. We have NCHP bill going on. So fortunately soon we will be having optometrist also for getting educational loan for their bachelor's or master's study.
सर मीन्स पहले फर्स्ट एक फाउंडेशन बिल्ड करें,
Yes,
देन उसके बाद दे कैन रन टू हाउ टू अर्न.
because initially you think that कि हम पहले पैसा कमा लेते हैं फिर बाद में सीख लेंगे, ऐसा नहीं होता.
देयर टाइम.
वो उस समय बहुत जोश होता है कि चलो पहले पैसे कमा लेंगे क्योंकि मेरे पास है नहीं, जब एक बार कमा लेंगे फिर मैं सीख लूंगा. तो योर माइंडसेट गेट चेंज, यू गेट totally commercial minded. So first you build the foundation, practice yourself, make an impact, then go for earning from various areas. And even if you are doing better, you will get automatically support from everywhere.
Sir, our next question is, what are the common occupational eye health problems and risk factors faced by marble industry workers, and how can these issues be eventually prevented?
Okay, so community marble health worker.
Yes, sir.
So those are mainly exposed to dust environment. So those people who are working in a mine industry or coal mines, they are mostly exposed to dust. So they might develop dryness of eyes. There should be photokeratitis and other eye problems like conjunctivitis. They can develop infection. And marble is basically a shining structure. So the light reflected can develop a cataract later on. So
Yes,
these are some eye disease that can be exposed, that can the person can get exposed to. So we can advise those workers to get a protective eyeglasses or UV protection glasses, or they can use a shield to do work in that. And even we can work on the ventilation areas, like the dust which is accumulated within that area. We can make them dispersed outside, or that does not get accumulated, so that the person can get most of its exposure from that marble area.
sir, our next question is, could you please discuss a recent advancement in vitreoretinal surgery that has significantly improved patient outcomes and reshaped current clinical practices?
Okay, so vitreoretinal surgery, earlier when I joined retina surgery was the complex surgery. वो डॉक्टर यूज्ड टू से 2-2.5 घंटे की सर्जरी होगी और उसके बाद फिर आपको 1 महीने तक उल्टा लेटना पड़ेगा. The patient got scared, or that was cumbersome, but that is actually needed. So currently the recovery timing has reduced because we have introduced 70 gauge vitrectomy, and even intra-op OCT has developed so that the patient, doctor can see the retina, like in case of macular hole surgery or ERM, the doctor can see intra-op the condition of the retina. And we have developed some genetic therapy also, and also we have some robotic assisted surgery, and we have even training online demonstration of surgical skills. So these are some advancement in retinal surgery which have made the patient recovery phase duration lesser. So the patient need not to wait for 3 weeks or 1 year, 1 month to get recovered. And the patient feel कि जब उसको बोलता है उल्टा लेटना है 16 घंटे, 24 घंटे में 16 घंटे उल्टा ही लेटना है, तो थोड़ा सा they got panic. So but these are some specialized procedures happening in some high-end hospital only. So these are some advancement. Later on it will be going on in the usual process everywhere.
Sir, what are your suggestions for managing patients who experience migraine but present with no apparent visual complaints? Means asymptomatic.
So basically migraine is a type of headache, and if the patient is not presenting with any ocular complaint, then we should move for the structural, beside beyond structural loss. We should go for functional. So we should, being an optometrist, we should not limit ourselves just for vision and best correction. And then we should go for a correction of uncorrected phoria, because sometimes phoria can aggravate the migraine, and sometimes prism can help in relieving those phoria and astropic symptoms. And sometimes squint also present there, so we need to correct that squint also. So these are some areas you need to look into. Even uh, surface disorders like dryness, they can also aggravate the migraine factor, because if you are blinking frequently, then you are rubbing the eyes more frequently with stress, so that can also aggravate migraine. So we can have a lubricant or blinking rate counseling to the patient. And in case if you don't deal with eye structure, then we should consult a neurologist also. So we have a collaborative approach to deal with the
Yes.
migraine which don't have any ocular symptoms.
So our next question is, how should we dispense spectacles for a child who has a congenital cataract operated one eye? Can we give progressive lens to that child, or one eye is enough to see near objects?
In that case, we should go for a distance correction only, because the other eye is seeing well improper. Because if you go for a progressive or bifocal, that is not well tolerated by that young 20 years old person. So we should always prefer to go for a monocular. The cataract operated eye should go for a monocular correction, and the other eye will be used for near work. And in case if the person is having excessive near work, then we can prescribe a separate near glasses to handle those near tasks. So mostly we should go for a distance correction only.
Sir, how do you foresee the future of visual therapy evolving with the integration of virtual reality and digital tools? In your opinion, will such technologies enhance or eventually replace conventional vision therapy?
Vision therapy is something which we you are dealing with a child, and if you are making that more interesting, the child will be more responsive. Because earlier when we started 5 to 10 years back, we have vision therapy exercises like Brock string flippers and other synaptophore exercises. We do routine practice to deal with the muscular anomaly. But currently we have a current trend is that we are developing a VR headset in the child visual perception skills developing. We are making exercise in real time environment. So we are making those interesting and more interactive, so that the patient and or the child is feeling more comfortable and more like a gaming technology. Suppose you are earlier we used to go and play uh, jo car racing, or that was going to a playing station. Now we have days VR headset, we can use that and we can play. Similarly, we have vision therapy exercises or perceptual skills that can be developed by that using VR headset. So vision therapy is revolutionary. We are dealing with muscular anomalies and other problem. So in future we have much more scopes. We will be developing similar devices. It is not that it will not be possible, it is not impossible. So we will be dealing with child attentive, child focusing, or child interesting gaming type of exercises that will be much more helpful and addressing those binocular dysfunction or accommodative dysfunctions.
Sir, there are many limitations in like OCT, in posterior segment evaluation, and how we can overcome this by newer imaging modalities.
OCT is the most used posterior segment diagnostic everywhere. So it is the basic tools that every ophthalmologist or optometrist they are using to detect any kind of retinal pathology, whether it is edema, whether it is presence of fluid. So the limitation is that we are not able to screen the peripheral retina. So the limitation is that we can scan only 8 to 10 mm of the central retina. So we are overcoming these limitations by using a wide field imaging techniques, or even the currently we are using swept source OCT, which is giving higher resolution and even we are wide field imaging that can screen the peripheral retina. So integrating wide field imaging, OCT, SSOCT, and other diagnostic instrument, we can screen the throughout the retina and can properly plan the management for the particular disease.
Sir, you have mentioned the swept source OCT, which is like the more advanced. For our viewers, can you describe all types like HD OCT and what others? What are their drawbacks?
Earlier we have a time domain OCT where resolution was less, and we have two mirrors. One was fixed and another was moving. We are capturing the optical path length. The later one came with the spectral domain or Fourier domain OCT, which was higher resolution as compared to the time domain OCT. And but we are using the source of light as the illuminating source, and we have a detector plate in time domain OCT which was replaced by spectrophotometer in the Fourier domain OCT. But the later swept source OCT is that the light source was replaced by the laser. So we are continuously sweeping the light laser, and we are capturing the scan in more details so that the minor pathology can also be captured, which was not captured in the spectral domain OCT, with wider field of view and better resolution.
Our last question is, in some patient, macular edema is observed alongside acceptance of a positive refractive error, and in certain cases, brain CT scans reveals the presence of tumor. There are possible correlation between these findings. If so, could you please explain the underlying mechanisms?
Basically, macular edema is associated with the shifting of photoreceptor layer slightly inward. So we are decreasing the actual optical length of the eye. So the focus is forming behind the retina, which is usually the reason for the hyperopic shift. So whether it is a case of macular edema or whether it is a case of CSR, the retina is displaced slightly inward. So the focus outside creates the plus correction or hyperopic correction. Similarly, in case of tumor or any other trauma, we have intracranial pressure develop on the optic nerve, which in turns leads to the swelling of the optic disc, and which in turns lead to the swelling of edema, retinal edema. And again, we can find the hyperopic shift. So we have a correlation that one pathology can be the secondary complication of the others. So if we consider about the macular edema, it can be secondary to that optic nerve tumor or trauma also. So we can correlate the hyperopic shift in both the cases, and sometimes there is no logic that key macular edema can be alone. It can be due to anything. We can see pseudophakic macular edema, we can have diabetic macular edema, we can have macular edema secondary to that glaucoma or any other pathology. So any disease can be interconnected as a secondary complication. So the pathology should be dealt with the underlying cause. The first pathology is what we have to treat that, so that the other secondary pathology can be subsided.
तो जैसा आपने अभी लाइक मेंशन किया कि स्यूडोफेकिया भी मैकुलर एडिमा कॉज कर सकता है.
Yes.
सर मैंने पढ़ा था ड्यू टू एनी सिंड्रोम आई कांट गेट एक्चुअली कि वो कैसे स्यूडोफेकिया मैकुलर एडिमा कॉज कर रहा है. आप थोड़ा सा
एग्जैक्ट कॉज किसी को नहीं पता वहां पे. बेसिकली क्या होता है, द सर्जिकल प्रोसेस एंड द विट्रेक्टोमी एंड एवरीथिंग, द प्रोसेस कैन लीड टू द मैकुलर एडिमा लेटर ऑन, बिकॉज आपका जैसे मुझे पिगमेंटरी ग्लोकोमा है, आपने वहां पे पिगमेंट डिपोजिशन हुआ और समथिंग दैट इज पोस्ट स्यूडोफेकिया, नॉट कि आपने सर्जरी किया आपके तुरंत बाद एडिमा हो जाएगा, हो सकता है उसके थोड़े दिन बाद हो. तो दैट इज secondary to after cataract surgery. So there is no exact cause known ki why pseudophakic patient always has edema, and it is not as necessary that all pseudophakia will lead to the macular edema. Sometimes in some case that can be either underlying cause, like किसी को systemic disease है, it is diabetes, it is hypertensive, at the time of surgery it was okay, later on it changed. तो उस केस में हो सकता है कि आपका फ्लक्चुएशन की वजह से हो सकता है. तो एग्जैक्ट कॉज इज नॉट नोन, अंडरलाइंग फैक्टर कैन बी एनीथिंग.
थैंक यू सर फॉर दिस वंडरफुल प्रेजेंटेशन. अभी वैसे तो और हमें एक्सटेंड करना है, बट ये बनते जाइए कम से कम रात तक सर. एंड रूपाली मैम ऑल्सो अ वेरी थैंक यू, उन्होंने सीबीआई के बारे में समझाया. अब सर मैं इससे पूछना चाहता हूँ कि लाइक इन फ्यूचर ऑल्सो कि कुछ क्लासेस अगर जैसे हम रखवाएं तो आप आना
Most
चाहेंगे
welcome. I am
मेरी तरफ
always
से?
most welcome. I am always there. You can plan any classes. I will be always there.
Sir, love to teach anytime.
I have talked about the
Student.
passion. So passion, this is my passion because I have not left Shroff. I started Shroff at 12,000, and at that time my in charge Prem sir has said that salary select कर ले या सीखना select कर ले. So I selected Shroff for learning and for making all that environment that I missed or that was lacking in there. तो मुझे श्रॉफ को ऐसा बनाना, मैंने पहले ही बोला, श्रॉफ is not a optometry community, it is optometry family. So all students feel loved there, guided by their seniors, all opportunity है, उनको कहीं hesitation नहीं होती वहाँ पे. तो be a part of that family and I have a passion for learning. You can ask me anything, you can, आप कभी भी मुझसे बोल सकते हो. I will be happy to learn and be a part of your family also.
लास्ट मतलब एक लास्ट क्वेश्चन ये है पर्सनल मेरा क्वेश्चन कि जैसे हमारे लाइफ में एक ब्रजेश सर है, आपकी लाइफ में आपके कोई ब्रजेश सर रहे हैं?
मेरी लाइफ में ऐसा कोई ब्रिजेश सर नहीं है, फेज बाय फेज है वहां पे. आई वाज सपोर्टेड बाय मेनी टीचर्स. एनएसएचएम नॉलेज कैंपस आई वाज सपोर्टेड बाय सजल सर, बाय विश्वजीत सर, अरूप बर्मन सर, दोज ऑल फैकल्टी. आई वाज द फेवरेट ऑफ एवरीवन. Here at Shroff, I was supported by all my faculties, whether it is Prem sir, AK Singh sir, Sonia ma'am, Surendra sir, Abhilek sir, all faculty, everyone supported me throughout my training. एंड मुझे कभी ऐसा फील नहीं हुआ कि मैंने वहां जाके अपने सीनियर से बात की. आई कंसिडर देम एज माय पेरेंट्स, एज माय एल्डर ब्रदर, एंड एवरीवन वाज रेडी टू सपोर्ट मी एनी टाइम एनीवेयर. एंड मुझे कभी ऐसा फील नहीं हुआ कि मैं सीख रहा हूँ. मुझे लगा वहां पे कि मैं फैमिली में एक ग्रो कर रहा हूँ वहां पे. एंड लेटर ऑन व्हेन आई बिकम अ पार्ट, इवन माय कलीग्स आल्सो, बहुत सारे ऐसे मेरे कलीग्स हैं, दे वर ऑलवेज देयर, दे वर ऑलवेज स्टैंडिंग विद मी. तो मुझे कभी ऐसा फील नहीं हुआ आई वाज अलोन. मैं अलोन था, लेकिन मेरी टीम इतनी अच्छी थी वहां पे कि दे ऑलवेज स्टैंड फॉर मी. सो माय अप्रिशिएशन इज दैट कि नॉट आई एम डूइंग वेल, that everyone, all my students, all my teachers, all my faculties, they always have faith in me. They always trust me. मैं मुझसे कुछ भी होता है, I am free to go and talk to them. I am free to talk to anyone. So that is my best earning in this optometry field.
Sir, according to me, you are not only the favorite student of the teachers, you are also the favorite teachers of student like us.
Yes, thank you for that.
एंड रूपाली मैम, एक लास्ट आपसे मैं कोई पूछना था कि लाइक जैसे हम सीवीआई के लिए क्लासेस कर रहे हैं,
Yes, yes.
हाँ, तो मैं कहना चाह रहा हूँ कि मैम कैन यू आल्सो टीच वन संडे ऑन सीवीआई
Yeah,
सेशन?
yeah. No problem. ब्रजेश सर के स्टूडेंट है, पढ़ाने के लिए कभी मना नहीं करेंगे.
थैंक
So
यू मैम, थैंक यू
श्रॉफ
सो
में
मच.
CBI, you know,
श्रॉफ में एक ही ऑप्शन है, दे डोंट हैव एनी चॉइस. आपको भी यही दिया गया है, किसी के पास कोई चॉइस नहीं होती. चॉइस
अभी
इज ओनली
तो
माइन, यू हैव टू डू दैट.
अभी तो जेनजी जनरेशन आ गई है. व्हेन वी आर इंटर्न ना, हम तो 9 9 बजे तक श्रॉफ में रहते थे. ऐसे लगता था 12 घंटे श्रॉफ पे ही जाते हैं. तो इट्स जस्ट लाइक दैट ओनली. एंड बट बीइंग इनटू श्रॉफ, you know, everybody who's just not got selected into Shroff, don't underestimate your power also. Whatever happens for a good reason. That I've learned in my life with my, uh, personal experience. But you don't have to limit yourself, and you don't have to underestimate yourself. Does not matter यार कि if I am performing retinoscopy, God knows, मैं तो ऐसे, I am very straightforward. Who think that okay, Rupali can do CVI, but I am doing CVI at my best. You know, those who are holding so many certificates, those who are doing international certification and all. So then, as like previously you taught ki we are lacking and we are behind from the US. So I've seen so many Australians and US people, they not get, the sufficient treatment whatever they want. So suppose if anybody is having esotropia, we all know that the plus refractive error is going to help. They are giving mixed, refractive error thing. So at least being into India, at least we know about that, what is refraction. So keep one thing in your mind: the refraction is bread and butter for you. If you know refraction, you can play with anything. You can play with retina patients also. Like, because nowadays I'm working with retina specialists, so I know, sir, trust me over that. Okay, 660 है, patient दिमाग खा रहा है, रूपाली के पास भेज दो. She will counsel a lot. So the artist, who is the artist of your life? Your mother gave you a bone, and you have to learn, you have to feed yourself, you have to do. Brajesh sir कहते थे options नहीं है, do or die. So that do and die make us so much stronger. And now we are even we are scared of speaking, we are scared of asking question, raising questions. Now we can correlate with our senior, we can stand in front of them and we can ask question, okay sir, how you are doing it. And whenever you are doing good, like even with the refraction also, if you are providing good someone's, and then you feel good, अरे यार मेरा तो ये है कि अगर मैंने दिन के 2 पेशेंट खुश कर दिए ना, that made my day. Nothing, no money can reward that much happiness to me. मेरा अगर पेशेंट ये बोलता है एक बच्चा है जिसका मैंने सिर्फ एनवायरमेंटल मॉडिफिकेशंस करके आई चेंज अ लॉट, सो दैट गिव्स मी द सेटिस्फैक्शन. मैन मनी कैन आई अर्न, अरे यार आज हमने पैसा कमा लिया, कल को हम लैम्बोर्गिनी खरीद के सारे उड़ा देंगे, BMW खरीद लेंगे. दीज आर एक्सपेक्टेशंस. बट अगर आपने एक 3 साल के बच्चे को, इफ द चाइल्डहुड ब्लाइंडनेस बिकॉज ऑफ कैटरेक्ट, विद योर रिफ्रैक्टिव करेक्शन, विद योर प्रॉपर गाइडेंस, इफ यू आर चेंजिंग समवंस लाइफ, देन वो आपके लिए लाइफ टाइम रिवॉर्डिंग रहेगा अदनान. And I am personally believing in these kind of facts. That is why everybody told me, madam, you have so much of experience. आपका नाम है, आप academics में चले जाओ, आप Lenskart चले जाओ, corporate में चले जाओ. But I choose to work in clinics because if मेरे क्लिनिक में कभी CVI नहीं होता था, मेरे क्लिनिक में विजन थेरेपी नहीं होती थी, जहां पर मैं अभी हूँ. श्रॉफ is a it's a become institution now, so everything is in Shroff. So if you are going anywhere, you have to spread your expertise. We are optometrists, we are not chashma wala, we are a clinical person and we are doctor too. एक डॉक्टर ने अभी एक रिसेंटली एक केस बताती हूँ, सिंपल सा एक केस है. शी इज हैविंग अ गुड, इतना फेस टर्न, एंड डॉक्टर इज राइटिंग फंडस इज नॉर्मल. And I have seen that child, because visual behavior is not good, so I am correlating -3 में इतना face turn, nystagmus is not that much, head nodding क्यों है. मैंने एट्रोपिन करके पीडियाट्रिक स्पेशलिस्ट के साथ बुलाया, and can you imagine that child is having cystoid macular edema with the RD. So that one atropine refraction of mine changed someone's life. So that a call, you have to take it. When you are going to take, how you are going to deal. Suppose, because in academics, being a topper is a different thing. But being into clinic, it's just like a Mahabharat ka Maidan for you. And you have to fight. You have to fight for your right. Even if you are working with, ophthalmologists. So they have some limited mentality. Arey yaar, they are only for refraction. But your knowledge can enhance your appearance in front of among of them. Okay, fine. I am sub advanced specialty and I can hold something. If ophthalmologist can limit to 660, then you have power to change it into 618. So make this much confidence on yourself. So that is the thing. Does not matter you are from LBPI, does not matter you are from NN, does not matter श्रॉफ में भी ऐसे भी बच्चे हैं जिन्हें मारते मारते थक गए, लेकिन उन्होंने कभी सीखा नहीं, एंड दे आर सेइंग पापा का बिजनेस ही तो चलाना है, बस हमें सर्टिफिकेट चाहिए. तो यू हैव टू चूज आपका माइंडसेट क्या है. सपोज यू आर सेइंग आप रूरल एरिया में हो, यू नो ओनली इंग्लिश. हाय तथागत, यू नो ओनली इंग्लिश. सो यार मातृभाषा तो हिंदी है ना, क्या शर्म है. यूएस वाले यहाँ आके अंग्रेजी बोल रहे, तुम हिंदी नहीं बोल सकते. इफ अगर अम्मा मेरे को बिहारी नहीं आती, इफ अम्मा से कथी लौकता, तो मैं भी उनकी भाषा में सीखती हूँ कि हाँ अम्मा किधर लौक रहा है. तो यू हैव टू मॉडिफाई योर सेल्फ अकॉर्डिंग टू पेशेंट. ऐसे नहीं होता जैसे, जस्ट फॉर एन एग्जाम्पल, आपकी शादी हुई है, पति ने बोला बिहार में जाओगी तो घूंघट करना पड़ेगा. सो योर माइंड सेट इज दैट कि हाँ करना है. तो इफ यू आर फ्रॉम यूएस, अरे आधे से ज्यादा 80% पॉपुलेशन इंडिया की यूएस कनाडा और हर जगह है, तो दे नो हिंदी ऑल्सो. अगर आप अर्बन एरिया में जाके कैंप में पूछ लोगे अम्मा गोले का साइड किधर से कटा है, तो वो आपकी एथेंटिसिटी यूएस से और कनाडा से वो बैच नहीं. अम्मा विल हग यू एंड गिव यू किस ऑल्सो. सो यू हैव टू चेंज अकॉर्डिंगली. This is the fact where you have to learn, where you have to identify yourself. Even कितने ऐसे लोग आए थे, तथागत is one of our bright student, but उसके साथ के कई बंदे ऐसे भी थे जिनको बहुत कुछ आता था.
लर्निंग और ऑप्टोमेट्री में हमेशा एक चीज दिखता हो, हर एक के अपने अपने स्टाइल होते हैं, अपने अपने तरीके होते हैं पढ़ने के लिए. बट मैं कोशिश करता हूँ ना, इफ आई एम पिकिंग अप एज इंस्ट्रूमेंट, any optometry instrument, so I can connect all the disease, all the anatomy, all the physiology with that instrument. और ये मुझे बेस्ट सर ने सिखाया है कि कोई भी एक टॉपिक उठा ले और उसके साथ सब कुछ कनेक्ट कर दे, तो देखेगा पूरा चीज एक बार में कंप्लीट हो जाता है. If you are picking a topic on OCT, so I can go anterior, I can go posterior, even after I can go tell you the anatomy and physiology also. So in that way, if you want to learn, so यहाँ पे बहुत लोग हो सकता है डाउट होंगे कि हम कैसे एनाटॉमी फिजियोलॉजी में नहीं है आपको इंटरेस्ट किसमें है, आपको इंस्ट्रूमेंट में इंटरेस्ट है ना, तो स्टार्ट द इंस्ट्रूमेंट. तो इंस्ट्रूमेंट के करते आप ऑप्टिक्स पढ़ पाओगे, इन सेम वे आप एनाटॉमी फिजियोलॉजी पढ़ पा रहे हो, इन सेम वे आप डिजीज पढ़ पा रहे हो, इन सेम वे आप ना उसके जो डिफरेंशियल डायग्नोसिस है वो जान पा रहे हो. तो आप एक चीज को पिकअप कर रहे हो ऑप्टोमेट्री में और सारे चीज जान पा रहे हो. सो इन दैट वे यू कैन कनेक्ट विद एन ऑप्थेल्मोलॉजिस्ट आल्सो. So
I
ये जो
think
बात होती है कि there is a
I'm
clear.
sorry. I'm really sorry to interrupt you, sir.
I know you are
I
running out of time.
completely agree with what you are saying and with what ma'am has said, but very, very unfortunately, we are running out of time. So I'm really sorry. I'm really sorry, but.
Very sorry.
And thank you so much for all the insightful conversations that we've had from your side, from Rupali ma'am's side, from Brajesh sir's side. And with that, we come to the end of today's incredible episode. On behalf of the entire team of Neuroptech, I'd like to express our heartfelt gratitude to you, Brajesh sir, for sharing your time, your journey, and your invaluable insights with us. Your words have not only educated, but truly inspired every listener, from students to seasoned professionals alike. A big thank you as well to all our experts like Rupali ma'am and Roy sir. It was really nice listening to you. My name is Shazia Shabbir. I'm your host for this very first podcast of Neuroptech. Until next time, stay curious, keep learning, and continue seeing the world through the lens of vision and purpose. Thank you and take care, everyone.
Thank you.
Thank you.
Thank you.
Thank you, Brajesh sir. Thank you, Rupali ma'am.
Thank you. Thank you.
Thank you. Thank you so much.
Thank you, Vijay sir.
Thank you, everyone.
Thank you, sir.
Thank you, sir.
The students are spamming. We love you, Brajesh sir.